why NDIS participants on BiPAP ventilation and seizure management need 24/7 critical care nurses, not disability support workers or general registered nurses. My name is Patrick Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies and otherwise medically complex patients, including home BiPAP, home CPAP, home oxygen, and seizure management, and where we also provide critical care nurses 24/7 at home for long-term ventilated adults and children with tracheostomies and otherwise medically complex patients. Today, I want to talk about why one of our NDIS clients, a teenager young man with muscular dystrophy, epilepsy, and global development delay, needs 24/7 critical care nurses at home instead of general registered nurses or disability support workers. So this particular client has complex, high-risk, and life support-dependent care needs, including BiPAP ventilation every night, but also sometimes during the day. He also needs a cough assist during the day, cough assist machine. He needs seizure management. He needs deep suctioning, nasogastric tube feeding, and full assistance with all activities of daily living. So here's why only 24/7 critical care registered nurses can safely manage the client's condition at home. And by the way, this is from an independent nursing assessment from a critical care nurse that's completely independent of intensive care at home. So let's look why this client needs CCRNs at home, because only they can safely manage his condition at home. BiPAP ventilation is life support. This client uses BiPAP every night and intermittently during the day. He cannot remove the mask himself, which puts him at high risk of choking, aspiration, and death if he vomits or has excess secretions. A CCRN is trained in emergency airway management, deep suctioning, and immediate response. General RNs and support workers are not. Seizures can kill without expert intervention. The client's seizures have lasted over 25 minutes in some instances. During a seizure, he can stop breathing, and only a CCRN can administer rescue medications like midazolam, diazepam, fentanyl, morphine, apply oxygen, suction an unstable airway, and manage the critical post-seizure phase. Again, support workers or even general registered nurses are not trained for this level of emergency care. Next, the client has myotonic dystrophy, which means he has weak respiratory muscles, which means he has no effective cough and is at constant risk of secretions building up and causing pneumonia. He requires a cough assist machine multiple times a day, deep suctioning, chest physio, and close monitoring. This is critical care level intervention. So, for example, a cough assist is nothing that registered nurses without ICU experience or let alone support workers are trained on or can safely manage, because it is basically like using a ventilator, just with even more potentially negative side effects if you don't know what you're doing, because you could cause a pneumothorax. Next, the client can't eat safely. Client is fed via a nasogastric tube and still tries some oral intake. A CCRN is needed to safely manage feeds, prevent aspiration, check tube placement, manage interactions with medications, and intervene if vomiting or tube dislodgement occurs. So especially with nasogastric tubes at home, the placement needs to be checked regularly, because otherwise the risk of aspiration is super high. And it could cause an aspiration pneumonia. Next, the client is at highest risk overnight. While asleep, the client uses BiPAP and a neck brace. A CCRN must monitor for airway obstruction, aspiration, seizures, or incontinence-related skin breakdown. This is not a job for a general RN or a support worker, but also while asleep, the client needs to be monitored for oxygen saturation, of course, and also the heart rate. And this is not just a list of tasks or to-do list. This is life and death care. The client's condition is medically fragile and unstable. Even a small delay or mistake in care can result in ICU admission, irreversible damage, or death. General RNs do not have the postgraduate intensive care training. Support workers have no clinical skills to manage medical emergencies. Only CCRN, qualified nurses with ventilator, airway, and emergency expertise, can keep the client safe at home. So here at Intensive Care at Home, we're always providing best practice, which is in this case 24/7 CCRN care at home, which is again according to an independent nursing assessment by another critical care nurse. Now, according to NDIS guidelines and clinical best practice, anyone on life support, including BiPAP, with seizure risks and respiratory compromise must have a critical care nurse available 24/7 to manage routine care and life-threatening emergencies. The NDIS Quality and Safeguards Commission has documented multiple preventable deaths due to lack of 24/7 critical care nursing in participants with similar needs. And I also refer back to the mechanical home ventilation guidelines on our website at intensivecareathome.com. They are evidence-based, and you will see that the mechanical home ventilation guidelines on our website will also reference the same, that exclusively critical care nurses with a minimum of 2 years critical care nursing experience are safe to look after clients on BiPAP, seizures, and nasogastric tubes at home. If you want to know more about how to get 24/7 critical care nurses funded by the NDIS, or if you're in a similar situation and you don't want your loved one to end up in ICU or worse, or if you're in ICU with a similar situation and you want to go home, contact us today at intensivecareathome.com. Now, with Intensive Care at Home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care, tracheostomy care for clients without ventilation, home care services for patients on non-invasive ventilation such as home BiPAP, home CPAP, home TPN, which is also known as IV nutrition, home IV potassium and home IV magnesium infusions, IV fluids, and IV antibiotics. We are providing central line management, peak line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, the use of cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day, and we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families and by a team of dedicated intensive care nurses in the home care setting instead of in an intensive care unit. With Intensive Care at Home, we are currently operating all around Australia in all major capital cities as well as in all regional and rural areas. We work with NDIS clients all around Australia, TAC and WorkSafe in Victoria, Department of Veteran Affairs all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are having policies and procedures for intensive care at home nursing, and we've built all the intellectual property for intensive care at home since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. So if you're at home already and if you're watching this, or you're stuck in an ICU long term, or if you're going to hospital and ED all the time and you realize that you don't have the right level of support at home, or if you are stuck in an ICU, I'll give you a real world example today how we can help you. One of our first clients when we first got started in 2012 was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a client at home on a ventilator with a tracheostomy. That is dangerous and it's simply negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at high risk of dying if they don't have a team of dedicated critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecarehome.com. Think about it. In an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind do that in a home care environment in the community? So this client at the time found out about us eventually, and the ICU that he was basically living in also knew about us and eventually reached out to us. And we were proving our concept with this client very fast. When we worked with this particular client, we sent him critical care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home and help you with keeping you at home predictably. Otherwise, we would not be in business. Again, the same is applicable for those stuck in an ICU, similar to this case study that I've just given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing NDIS support coordination. We have a team of NDIS support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDIS support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management and WorkSafe case management in Victoria with Lucy McCodder. If you're an NDIS support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. If you need more evidence for nursing care, we are also writing NDIS nursing assessments with legal nurse, critical care consulting nurses. If you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, we're employing hundreds of years of critical care nursing experience combined. You can join this high-performing team if you are a critical care nurse. If you are looking for a career change as a critical care nurse, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo, in Geelong, in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again because they are so vulnerable and so special. That's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts and you're really keen on building solid relationships with us and with our clients. If you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or for home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US and in the UK, and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecarehome.com. Call us on one of the numbers on the top of our website or simply send us an email to info@intensivecarehome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.